Hi, everyone. Kathy Buccio here, host of the South Florida PBS Health Channel. Today, we have a special conversation with Dr. Kerry Forrestal. He is an attending physician and emergency service associate as well. He is the author of Crushing Cancer, a patient's complete guide to managing a cancer diagnosis. And he has been in the medical field since the age of 16. He started out as an EMS when he volunteered at the age of 17, and he went to medical school at Stony Brook, New York, and completed a residency at Thomas Jefferson University Hospital as well. Dr. Forrestal, I want no more interruptions or any more stalling, so I want to get right to it. Welcome so much to the South Florida PBS Health Channel. Thank you for being here with us. First off, I'd like to know a little bit about you, a little bit more about your background, and tell us a little bit of how you got into medicine in the first place.
So, yeah, I started with the American Legion ambulance in my hometown. My mother in the 1970s was an ambulance driver, which was, it was not a time when women would go tearing around in ambulances at 100 miles per hour. So she was a bit of a pioneer there. And it looked cool with her running out the door at all hours of the night. I said, oh, I'm going to try that. So at 16, actually, I started with the American Legion ambulance. And they were okay with it. They were okay with having a 16-year-old running around in the middle of the night because they were like, these were World War II vets. They're like, at your age, I was killing Nazis. So it was like, okay, I just want to ride around in an ambulance. Thank you. So it went from there to, it just right on up the ladder. It was like, that looks cool. I want to be a basic medic. I want to be a paramedic. And then, it just after a while, I did this for 17 years and always in the back of my head when I was going to school and just throughout, it was eventually I was going to be a doctor, and I did a lot of other things. I joined the Air Force, the Air National Guard. I was on commander's staff doing drug and alcohol abatement and diversity issues. I worked at Wall Street for a while doing computers for Chase Bank. Did a whale and seal stranding team, chasing seals all over Fire Island in the middle of the night. So, and then finally, I got to be about 33 and said, okay, now it's time. So went to medical school at 33. I was the second oldest person in my class. So, yeah, it's been a long, interesting trip, but it started with the people from the VFW and the American Legion Ambulance giving me my chance.
And I love that it's stemmed all about community for you and about helping a community, about helping others as well. And I want to get right into the book because obviously something led to this book. As the other things in your journey. So what made you write Crushing Cancer?
So it's a question I get a lot, and everybody asks, why is an ER guy writing a book on cancer, right? And it's actually a three-part answer. The first is in the emergency department, we see so much of it. We see people come in and they've got a cough and we take the picture, we take the x-ray and we have to go, ooh, okay, that's not a pneumonia. We need to sit down and have a talk. And we send a lot of people out with this potential diagnosis. And it's always been very hard for me because I want to do more. It's like, you have a problem. I've got you set up with an oncologist. Good luck. That doesn't sit well with me. So I wanted to do something that went beyond the walls of the emergency department. The second is on the other side of that, when people are in treatment, we see that things kind of can go off the rails. And sometimes it's preventable if people had better information. Now you say, okay, well, we've got the entirety of the internet. The internet is as much good as bad. And, I always make the analogy. My father's a mechanic, and they used to have those guides, those Chilton guides where you could, take apart and put together an F Ford 150, if you knew how to read it. If you give it to him, he can do that. You give it to me, the wheels are coming off because I don't know how to process the information in there. So, it's dangerous in my hands where it's a resource in his. So the best story I have on somebody doing something on the internet that didn't quite work out, guy came in for a headache and a nosebleed, and he had an echinacea tea bag stuck in his nose. So, okay, why do you have an echinacea, stuck in your nose? He says, well, I read it on the internet. I said, okay, so why haven't you taken it out? He goes, because I can't now. It's infected. And he'd almost abscessed up into his brain.
Oh my
so,
God.
The internet, if you know what you're looking for, it can be a resource. But if you're just kind of bungling around in there, it can be dangerous. So there's that. And then the last is, of course, in my family, it runs very strongly. My father's had skin cancer. My mother's had 3 bouts of lung cancer. My grandmother, 2 bouts of uterine cancer in the day when all they did was pack the area with radium pellets, if you can believe that. And she survived twice. I have a brother-in-law who's had prostate. I have a cousin, actually, I just lost to brain cancer. But of all those, the cousin and my grandfather were the only two who passed. So we were getting better and better at treating this, but it's something that strikes close to home. I have not, knock wood, had cancer, yet, but it's in the genes.
Right. And I think it comes first and foremost from having that sense of information. I think you really hit the nail on the head with that. I think so much of the time we're not informed. We do not know what to look for. We do not even know how to approach a diagnosis. And I think that's what's wonderful about your book. And one of the things that you talk about in the book is when you receive a cancer diagnosis, it's very stressful. Obviously, it's overwhelming, but not only does it affect the patient, it affects the family. So explain a little bit about how a diagnosis is not just a singular diagnosis, but something that affects everyone.
It does. It's a cancer diagnosis affects every aspect of a person's life and every aspect of the family's life. This becomes a focal point for everything everybody does. Very often it can be just as stressful for the caregivers and for the people around because there's less that they can do. They're just processing, and they don't know what to do for the person. They don't know how to help. And sometimes it goes astray. Sometimes they're trying to help, but it doesn't quite come out the way they were hoping. So yeah, it's cancer is something that affects every part. And part of this is we actually go into some of the things that people say that are very helpful and some things that were maybe not so helpful. So there's a whole section in there.
I do like to touch that because I think what's important is how do you even start with handling or processing, if you're the patient, let's say, a cancer diagnosis? What has been the most surprising for you?
So I think the thing with cancer patients that really blows me away is, they get this initial diagnosis. And part of the reason why we write the book is, I can go in and I can say, look, I think you have a problem here. And the way it's been described to me is next step is I sound like Charlie Brown. Wah, 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 wah. Nobody's processing anything, and they're not going to for a little while. That's why the book is there, so that when you're ready to process, it's there. But what becomes amazing to me is that the patients then, once they kind of get their footing, they're incredible. They are just, they become so knowledgeable and they become so capable. A lot of the patients who were in treatment at the time I was writing the book educated me about all aspects of this, not just the cancer or the treatment or what are the tricks that you can do that'll make it easier. How do you manage the finances? What are the legal problems? What are all of these things were things that they said that they needed that they educated me on. So, and I don't want to feed into that what they call toxic positivity, where we expect our cancer patients to be happy warriors. Feel the way you feel. You have to process that. You shouldn't put on the show for people just because you don't want them to feel bad. But people do get to be incredibly capable. And once you have a plan, the power of a plan can't be understated. At first you go, oh, I'm overwhelmed. And you go, okay, this is what I'm going to do. 1, 2, 3. So there's a lot of power in there. And it is amazing how quickly people get to that.
Let's talk about those do's and don'ts. I think we talked about that toxic positivity because, as you said, we need to feel all the feelings, all the emotions. It is a process, but we also need to, if we're coming from the outside in for this patient, there are things that we can do and say that are helpful, and there are things that maybe are not. So what is it that you've seen from speaking to families or even your own experience, things that are helpful and things that aren't?
When we talk to people who are sick, who are seriously sick, like when we started this segment, you had an upper respiratory thing and an ear, and that's easy because we know you're going to get better, right? When you're talking to somebody with cancer, you're, oh gosh, what do I say? And honestly, the best thing I can say, own it. Just say, look, man, I love you, but I'm not, I'm here for you no matter what, but I'm not sure what to say to you to help. How can I help? And don't feel the need to carry the burden. Like, share it. Just say, look, I'm here. I don't know what to say, but we'll figure it out. And you don't have to do anything more than that. Just, if this is a person in your life who you genuinely love, that's it. That's all you need. Is to say, I'm there.
Right.
Just, I don't know what to say. I've heard some of the stories we collected was like, oh, that's the good kind of cancer. What? There's no good kind of cancer. They're just, it astonishes, it floors you what people say. And some of it is they're trying to be helpful, but they just don't know what to say, and they get gummed up trying to help. So, and from the other side of it, if somebody says something incredibly stupid to you, unless there's somebody you don't like and it's a malicious thing, just understand it's probably coming from a place of love and they're trying to help, but maybe not so much.
Maybe you can laugh about it later, right?
Yeah. It'll be, once this is all in the rearview mirror, then we'll have a chat.
Exactly. Okay, so I want to read something to you about a new study in Nature Reviews Clinical Oncology. They reported that over the last few decades, doctors have been seeing a dramatic increase in cancer in adults younger than 50. So why do you think we're seeing that onset? Is it lifestyle? Is it environmental? What could it be that we're seeing an increase, especially at a time when we're seeing more technology and more medicine? Cancer still falling in that line of, we don't necessarily have a cure.
Right. So we are, that's a multi-part. So let me take the first part first.
Yes.
So why are we seeing more? It's multifactorial. The first thing is, of course, we're screening more. And that's not all of it by a long shot, but that's some of it. So we're getting better at screening for cancers. We're in the book, we talk a little bit about liquid biopsies, which are basically you can detect cancer on a blood draw that are not leukemia or any of the bloodborne cancers. So there's the screening element of it. But then there's the element of we don't treat our environment very well. Even when we're trying to do good things like, make the lawn look pretty for, whatever HOA you happen to be with, there are pesticides. And we know from the weed killer and the leukemia thing, maybe that wasn't the best idea. Just toxins get dumped out into the environment constantly. So our environment has toxified, even though we're trying to be more mindful about not doing that. And then there's the diet end of thing. Now, the article that you references by Dr. Ogino, and I actually went when you did, I was looking that up and referenced that, and it was amazing. It was a very interesting study. His work is basically saying that the things that we eat a lot of processed food, and we don't think about what that means. When we say it's processed food, that means it's chemically treated. Now, those chemicals get into our body and they can cause inflammation in the gut. This is Dr. Ogino's work. Yes. And it can cause inflammation in the gut. Now, in that first chapter about what is cancer, we talk about the cell turnover gives you more opportunities as your cells copy themselves for things to go off. They can miscopy, and if you have the genes or if you just hit it right, you can get a cancerous growth. So the more inflammation you have, the more cell turnover you have, the more opportunities you have for cancer. And that is anybody who's scientifically based or a doctor just cringed, because I just made that as blisteringly, it's probably oversimplification. It's a little bit like saying, how does a plane fly? Well, the air goes over the wings. It's a lot more complicated than that, but at its base, that's what happens. The more inflammation you have, the more opportunities you have for cancer to come about. And that's Dr. Ogino's work. It's fascinating stuff. He's working with a bacteria called Fusobacterium nucleoforme. I probably got that wrong, but it's an interesting line of inquiry, I guess would be the best way to say it. So all of those three things, we find it more. We don't do a great job of keeping our environment clean. And again, our body's clean either. We feed junk into it. If you want the good stuff, shop around the edges of the supermarket. Most supermarkets are set up so that the less processed, not unprocessed, but less processed foods, you have dairy, meat, produce are around the sides. The stuff in the middle is usually the overly processed junk.
Right. Absolutely. Diet and exercise in our lifestyle really plays a huge part into this. And screenings. I want to go back to screening, something you mentioned in the book as well, but I want to talk about the importance of screenings. We're getting more screenings. We have our yearly mammograms for women, we have colon screenings as well. But many people, especially in the community, don't understand that screenings are available to all. And there are regulations as to what age we should start these screenings. So can you talk a little bit about the importance of screenings when it comes to cancer and early detection?
Yeah, if you look at the survival rates across the board, stage 1 is going to be the best, stage 4 is going to be not as good, right? It's going to be the worst. So stage 1, 2, 3, 4. The earlier you can catch this, the better you're going to do. And that comes down to screening. When you start having symptoms, you're usually more advanced into the disease. Things like pancreatic cancer, you don't get symptoms until really late, 3, 4, stage 3 or 4. But something that's obvious, like a melanoma or a skin cancer, we catch generally early on because what's this, doc? Okay, we need to biopsy that. So the earlier you can catch it, the better off you're going to be. And screenings right now, we need to do a better job at getting people screened in minorities, in disenfranchised communities. The screening rates are just lower, and there's no acceptable reason for that. We have to, as a community, make that effort to reach out. Some of it can be distrust of the system, and some of it is just lack of resources in an area. There are we know about food deserts, but there are also medical deserts. When people have to travel for an hour to get a mammogram, some people don't have the capacity to do that. So we need to do a better job as the medical community in reaching out, and certainly municipalities can help out too.
Is there part of that fall as well as some healthcare sort of equity with, as you said, there are areas that, as you said, it's a lower income community, maybe certain ethnic groups and nationalities as well don't have that access, but it's also, as you said, distrust, but also there's not that equity, especially when it comes to healthcare. Are you seeing that, especially when it comes to these cancer diagnoses?
Oh yeah. The one stat that came out not too long ago that floored us all, if you take two women and you match them for age, background, economics, everything, a career, if you make them twins in everything but race, okay? If you have a white woman and a black woman is going to have a 40% greater risk of dying of breast cancer. That is wholly unacceptable. How can we live with that? And we shouldn't, and we need to make that effort. We need to do better at reaching out. And again, some of it is the medical desert. Some of it is, a lack of information. Some of it is distrust. We know that the medical community has not done a fantastic job. We have Tuskegee, we have the Guatemala, we have all of these things that historically have not really been shining moments for the medical community. But we need to come through that, and we need to partner with these communities and say, look, I only thing I can say about what's gone on before is I hate it too, and I'm here now, and I want to do what I can to make sure that your mothers and your sisters and the people who are important in are not going to have a 40% greater chance of dying from breast cancer just because they're Black. That's not okay. No.
Absolutely. So what does that cancer diagnosis look now compared to 10 years ago?
So the cancer, we're getting better and better at doing this. I think the cancer survival rates were maybe 49%. It's kind of a flip of a coin back in 1970. And, now we're crowding over 70%. Some of them are still hard. Pancreatic cancer is still quite difficult. Some of the brain cancers, glioblastoma, and those can still be quite difficult. But we're entering an amazing age. And this is one of the big themes in the book. We're entering this phase of hope, where we are now just starting to get to immunotherapy. We're unlocking the way to get the body to fight the cancer, as opposed to us introducing chemicals, radiation, or, as the surgeons like to say, heal with steel, you cut it out. We are figuring out how to train the body to actually fight the virus, to fight the cancer. And the reason why I flashed on viruses there is they're now working on viruses that are called oncolytic viruses, where we're going to create a virus, introduce it, and it will specifically go after a melanoma or some other form of cancer. So we've got viruses now that we can introduce. We've got ways of training your own T cells, part of your immune system, to go after these things. All of these things are a cause for hope. I was having a discussion not too long ago with a young lady who was undergoing care for, I think it was inflammatory breast cancer, I think it was stage 4, and she's doing pretty well. And while we were talking, the whole idea now, with what we see, what the oncologists are doing, what the scientists are doing, is when you get the cancer diagnosis, we're moving from a situation of, oh no, to, oh yeah, all right, you want to try this? Let's go. Because we've got the tools now where people are going to do better and better and better. We're going to look back at this age and say, man, did you really do chemo back in those days? Come on now. We have oncolytic viruses, and we've, for the first time in history, cured or prevented cancer with a vaccine. We have the HPV vaccine, and the first cohort of women have come through now who have gotten the vaccine, and they're reporting a 65% reduction in cervical cancer in these women. I mean, that's prevention. So every single one of those things are ever more positive. I could not actually put in the book what the immunotherapy stuff was going on right now, because it was moving so fast, it would have been out of date by the time I got the book published. So,
which is a good thing, right? It's a good problem to have, Dr. Forristal.
It is a fantastic problem to have, and people should go away. The people who hear this, if you've just been diagnosed or if you're working with cancer, just keep an eye out for some of the studies that are going on, and just keep hopeful, because it's better and better and better. We are better today than we were yesterday, and we're going to be better tomorrow.
Absolutely. I love that you used the word hope, and it sort of brings me back to your book. Was that also a big part of the intention of the book, to give hope to those with a cancer diagnosis and families as well?
Yes, definitely. I think one of the things we've got nice reviews and from professional organizations, and that's great, but I'm very grateful for them. But the one that got me, a friend of mine, a dear friend from college, his mother-in-law was diagnosed with breast cancer. And he gave her the book, and I wasn't thinking when we were at his daughter's wedding just this past summer.
Right.
And I turn around and boop, there she is. The lady is there. I've never met her before. And she's right there. And she says, "Thank you for the book." And I said, "Oh my gosh, that's wonderful. I'm glad it helped." She goes, "It took away my fear." That was it. I was just right there. I was like, I got nothing. I'm an ER guy. I'm used to responding to things that just pop up at you. That's my living. Not this. I was not ready for this. So, and it was wonderful. I mean, and that's the thing is once you have knowledge and once you have a plan, the fear falls away and the fight begins. And, it's like I said, it's a fight that we're getting better and better at winning. So people should absolutely be hopeful. They should absolutely look at this and go, okay, you want to fight? All right, let's go. That's I guess I'm just Irish.
You just want to fight all the time. No, but I think it's to hear it from a patient, to hear it from family. I think that's where it really hits home. I think that's a 5-star review right there. I want people to know about your book, Dr. Forristal. Where can they get the book? Where is it available? And will you be making any signing appearances coming up that maybe someone may want to meet you and say thank you in person?
Absolutely. So the book is Crushing Cancer, A Patient's Complete Guide to Managing a Cancer Diagnosis. It's currently available on Amazon, a lot of the electronic readers as well. If somebody wants to have me come down to Florida and do a signing, I'm 100%. We're doing a couple things to get the book out. For example, to vets, free of charge to them. 50,000 vets a year are diagnosed with cancers. I'm not going to do the Camp Lejeune thing, but they need access to this book because the VA does not treat. They farm it out to the communities. So you have the veterans are used to getting their care here. Now they have to go to the communities, and this helps to be a resource guide for them. So we're working with some groups to try to get it out free for them. Firefighters, they have a double in some cases, incidence of cancers. We're working on getting the book for them for free. And then we're going down to American Library Association in Chicago in June to try to get it into the library so people can get access to it free of charge. So, we're doing all of those things to try to get out. And the other one that I should mention is that, we talk about in the book a lot about the finances of it and trying to make sure that you don't go broke trying to save your life. But if you do accumulate that medical debt, there's a companion book that another physician wrote called Crushing Medical Debt. So people can, about 3% go bankrupt just from trying to treat their cancer. And 3% doesn't sound like a huge number until you apply it to 2 million people a year.
Right.
Then those numbers start to add up, and you could be left with what's also called financial toxicity, where, okay, you don't go broke, but your life is going to be spent trying to service that bill. And that's a good book. Medical Debt, if you do get it, Dr. Virgie Bright Ellington tells us that 80% of medical bills are wrong and not in your favor. So check the bills when they start coming in and make sure if you see something that doesn't look right, contest it. If the insurance company won't pay the bill, ask for the name of everybody who made that decision, because all of a sudden they get a little, well, maybe we can't pay the bill. So just a couple of tips there.
This is fantastic insight. So we'll pick up not only yours, but crushing debt. We like that one too. Thank you so much, Dr. Kerry Forrestall, for joining us here on the South Florida PBS Health Channel. It's been such a pleasure having this conversation with you. And again, we're going to post this on our social channels as well as our website so viewers can watch. Crushing Cancer, a patient's complete guide to managing a cancer diagnosis, available on Amazon. Dr. Forrestall, thank you so much.
Thank you so much for having me. I appreciate it. Be well.
Of course.